Diagnostic testing. In this lesson, we'll take a look at a physical exam along with laboratory tests and other imaging studies, as well as some common specialized diagnostics used to make a diagnosis. We'll begin by reviewing a physical exam. Often, the first physical test each patient will undergo is to obtain their vital signs. This is usually done by the office staff prior to the patient being seen by the provider. The readings for height, weight, body mass index, abbreviated BMI, blood pressure, temperature, pulse, and respiratory rate will be documented, as well as the patient's pain rating on a scale of 0 to 10 out of 10, if appropriate, with 0 being no pain and 10 being extreme pain. Once the provider begins examining the patient, they will normally begin with visual inspection first, including symmetry, color, size, and any notable deformities. Next, the provider will move on to auscultation of various systems using a stethoscope. The cardiac system will be assessed for rate and rhythm. Abnormal findings would include a gallop or a rub, as well as arrhythmias or murmurs. Auscultation of the respiratory system assesses the lung sounds. Normal findings would be noted as clear to auscultation. However, abnormal findings involve the quality, such as diminished or hyperresonant, and the clarity with documented adventitious breath sounds like rails, sometimes called crackles, rhonchi, or wheezes. Auscultation of the abdomen will then be performed to assess bowel sounds. This will be done in each of the 4 abdominal quadrants that are documented as the right upper quadrant, left upper quadrant, the right lower quadrant, and the left lower quadrant. These are abbreviated RUQ, LUQ, RLQ, LLQ. The quality of the bowel sounds will be noted as normoactive, hyperactive, hypoactive, or absent. While assessing the patient's joints during movement for range of motion testing, abbreviated ROM, the provider will be listening for a sound of grinding, grating, or crunching called crepitus. Crepitus may also be palpated. Other areas of soft tissue will also be palpated by the provider to assess for pain and swelling. Swelling due to fluid inside of a joint is called effusion, whereas fluid in the soft tissue is edema. The abdomen will also be palpated in each of the 4 quadrants, as well as the epigastric region over the stomach, to note the firmness as either soft, which is normal, or distended, which is abnormal. Discomfort to palpation of the abdomen will also be documented as tender, non-tender, rebound, or guarding. Palpation of the lower extremities assesses the skin temperature, the pulses, including the dorsalis pedis, popliteal, femoral, and the posterior tibial, and the presence of any edema. If edema is present, it will be noted as either pitting, which leaves an indent when pushed on, and is rated as 1 to 4 with a plus sign, or non-pitting, usually documented as trace, mild, moderate, or severe. During the exam, the provider will perform tapping of various body cavities. This is called percussion. The abdominal cavity will percuss the stomach, intestines, spleen, pancreas, gallbladder, and liver, while the upper back and chest cavity percuss the lungs. The lungs are divided into lobes. The right lung has 3 lobes, including the right upper lobe, abbreviated RUL, the middle lobe, RML, and the lower lobe, RLL. The left lung only has an upper lobe, LUL, and a lower lobe, LLL, due to the placement of the heart in the cardiac notch. The lungs are further noted as anterior or posterior, and the description of the sounds elicited during percussion include tympany, which is over air-filled organs, dullness over solid organs, flatness over bones, and resonance over lungs because they are hollow. The quality may be documented as dull or flat, indicative of fluid in the lungs found in pneumonia or pleural effusion. Hyperresonance may be detected when there is too much air around the lungs, as is found with COPD, especially emphysema. The provider may perform range of motion testing of joints and will note the findings in degrees. Active range of motion is performed by the patient and passive is done by the provider. Different planes of movement will be assessed for the joints such as flexion and extension, abduction and adduction, and rotation for ball and socket joints like the shoulder and hip. Forward and lateral flexion will be performed for the spine along with extension. Dorsiflexion and plantar flexion assess the foot range of motion. Range of motion will be noted as either full, decreased, or hyper. Reflexes, often called deep tendon reflexes or DTRs, may also be tested by the provider who will document the findings as 1 to 5 with a plus sign. Normal reflexes are noted as a 2+. Brisk, overreactive, and hyperreflexia are between 3+ to 5+, respectively, and hypoactive or hyporeflexia is 1+, with 0 being absent. There are 5 DTRs, including the biceps, triceps, brachioradialis, patellar, and Achilles. Now we will discuss laboratory testing. One of the most common types of laboratory testing involves evaluation of a patient's blood for different substances. Providers will routinely order such testing like a complete blood count or CBC that provides values for a red blood cell count, abbreviated RBCs, white blood cell count or WBCs, and platelets. The amount of hemoglobin contained in the red blood cells, along with the percentage of the blood volume that is red blood cells, called the hematocrit, are also routinely ordered together and may be called an H&H. A CBC may also be ordered with a differential, which we can also call a diff, that breaks down each type of white blood cell, including neutrophils, lymphocytes, eosinophils, basophils, and monocytes. Another common blood test is a metabolic panel. This may be a basic metabolic panel, or a BMP, or a complete metabolic panel, which we call a CMP. These tests provide the amount of electrolytes like sodium, potassium, chloride, and calcium, along with glucose in the patient's blood. They also assess the kidney function by measuring blood urea nitrogen, abbreviated BUN, the creatinine, and possibly the estimated glomerular filtration rate, or EGFR. Liver function tests, we abbreviate LFTs, are the difference between a BMP and a CMP, and they include aspartate transferase, called AST, also known as SGOT, alanine transaminase, or ALT, also called SGBT, and alkaline phosphatase, or ALP, as well as bilirubin, total protein, and albumin. Certain patients with specific respiratory or metabolic disorders may have arterial blood gases, or ABGs, ordered. This would include patients with cardiopulmonary and kidney disorders. The ABGs measure the amount of carbon dioxide, or CO2, and oxygen, which we abbreviate O2, along with the pH and bicarbonate. Abnormal findings indicate acidosis or alkalosis, depending on if the pH is low or high, respectively. The acidotic or alkalotic condition can be further discerned into respiratory or metabolic. Those patients with a history of a clotting disorder with a previous thrombus formation or those currently on blood thinner medications will routinely have coagulation studies performed. Prothrombin, also abbreviated PT or ProTime, partial thromboplastin time, or PTT, and international normalized ratio, or INR, will be ordered on an ongoing basis for these patients. Patients with other metabolic disorders will also have regular blood tests ordered. Those with thyroid disorders will frequently have their thyroid stimulating hormone, or TSH, as well as their T3 or free T3 and T4, known as thyroxine or free T4, measured fairly often. Patients with hyperlipidemia or high cholesterol will have a lipid panel ordered at routine intervals that measure their high-density lipoprotein, also called HDL, their low-density protein, or LDL, as well as their triglycerides and total cholesterol levels. Diabetic patients will undergo evaluation of their hemoglobin A1C, or just A1C, that measures long-term blood glucose levels. Male patients, especially those at high risk, will have intermittent screening for prostate cancer by checking their prostate-specific antigen, or PSA. This would be mainly for males over 50 or younger if they are at high risk. PSA is an early marker for prostate cancer. Women of childbearing age may require pregnancy tests for human chorionic gonadotropin hormone, or HCG, of which there are two types. A quantitative serum pregnancy test measures the exact amount of HCG in the patient's blood, while qualitative only detects the presence of HCG. Blood serum pregnancy tests are more accurate than urine tests and can detect pregnancy at 7 days from conception. An autoimmune disease panel may be ordered if a patient has a family history or symptoms consistent with a variety of autoimmune disorders. The anti-nuclear antibody, or ANA test, is the first-line testing and is considered the gold standard because of its high sensitivity. However, positive results require further testing with the C-reactive protein, or a erythrocyte sedimentation rate, abbreviated ESR, and sometimes called a SED rate. It detects inflammation, and these results, combined with symptoms, are used to diagnose specific autoimmune disorders like rheumatoid arthritis, or RA, systemic lupus erythematosus, or SLE, and Sjogren's syndrome, as well as several others. Besides blood, urine is also frequently tested in a lab. A urinalysis will likely be ordered with or without microscopic examination to detect infection and casts. During the urinalysis, the urine appearance is assessed for color and clarity. Other solid substances are detected, including glucose, blood, protein, ketones, bilirubin, and urobilinogen. The amount of these solid substances impacts the urine's specific gravity. Just like the blood, urine can be tested for its pH to indicate a state of acidosis if the pH is low, or alkalosis if it's high. Diabetic ketoacidosis, or DKA, is a medical emergency for those patients with diabetes. Microscopic examination of the urine will be ordered if infection is suspected to evaluate for the presence of nitrites, leukocyte esterase, organisms like bacteria or yeast, red blood cells, white blood cells, and epithelial cells that are markers for a urinary tract infection or a UTI. Casts may also be present that can signal issues with kidney excretion. For those patients with a suspected UTI, a urine culture sensitivity, or a CNS, will be ordered to identify any microbe growth as well as the specific pathogen, along with the estimated amount in the urine sample. If an organism is identified, antibiotics will also be suggested to which the germ is sensitive and susceptible. Some patients may require a 24-hour urine test. A special container will be provided to the patient to collect all urine for 24 hours, which must be kept cool. At the conclusion of 24 hours, the patient returns the container to the office to be sent to the lab for analysis. This test measures urine volume, as well as creatinine, sodium, potassium, urea nitrogen, and protein. Other tests may be performed on the patient's urine, including a pregnancy test for HCG. Drug panel screenings may be ordered for suspected overdose or for pain management patients for routine screening as a condition of their treatment. Specialized testing of other body tissues and fluids may be ordered for specific patients. Specimens are then sent for pathology. Biopsies can be performed on both tissue and fluid to detect dysplasias, which is abnormal cell growth, that could indicate tumors or cancerous growth. For example, a punch biopsy may be obtained from a suspicious skin growth, and a pap smear scrapes cells from the cervix of females for microscopic analysis. Biopsies of other tissues and fluids may be used to detect infection. The GI tract may be biopsied during an esophagogastroduodenoscopy, or EGD, also called an upper endoscopy, to detect the presence of the bacteria Helicobacter pylori, which contributes to the formation of gastric ulcers. Synovial membranes and fluid located within a joint may also be obtained during a fine needle aspiration or biopsy to detect infection, gout, or specific autoimmune disorders. Feces, also called stool, can be tested for occult blood that may indicate issues of the colon. A hemoccult or guaiac test detects blood in the feces that may not be visible to the naked eye. The patient is given 3 hemoccult cards to apply a smear of feces to, which is then tested in office or sent to a lab for testing. Stool samples may also be sent to the lab to identify infectious processes, typically due to bacterial or parasitic infections of the intestines. Mucus produced in the respiratory tract may also be sent to the lab for testing. Sputum, also called phlegm, may be tested for tuberculosis, abbreviated TB, with an acid-fast bacillus or AFB culture, using an acid-fast stain to identify organisms. Other organisms are not stainable. Sputum may also be sent to cytology to evaluate for cells consistent with lung cancer. The nasal passages of the nose may be swabbed to obtain a mucus sample. Examples of infectious disease that utilize nasal swabbing include influenza, better known as the flu, COVID, and other respiratory organisms including methicillin-resistant Staphylococcus aureus or MRSA, usually referred to as MRSA. Now we'll move on to discuss imaging studies. We'll begin with indirect imaging studies that use radiation. One of the most common types of imaging tests providers order are X-rays. These imaging tests use ionizing radiation to create an image. There are several different types of X-rays, including plain radiographs, which are frequently ordered to evaluate solid structures like bone, as well as semi-solid objects like fluid-filled organs. A computed tomography or CT scan also uses X-rays to create a computerized image of internal body structures. Mammograms are another form of X-ray imaging that evaluates the breast tissue in female patients. Similar to a CT scan, fluoroscopy uses X-rays but creates a real-time video of body structures. Both a CT scan and fluoroscopy can be performed with or without intravenous contrast dye administration, which enhances the imaging. Fluoroscopy is typically used during an angiography to evaluate the vascular system, but it's also used to visualize the GI tract as well as joints during arthrography. During angiography, fluoroscopy is implemented of the blood and lymph vessels. This requires catheterization of the vessel to inject contrast dye deep within the selected vasculature. Angiography includes arteriography, which involves use of fluoroscopy to detect a blockage, called an occlusion, of the coronary arteries of the heart, or the carotid arteries in the neck that deliver blood to the brain, as well as to other major arteries throughout the body to assess for peripheral vascular or arterial disease, which we abbreviate PVD or PAD. Venography is similar, but typically involves veins of the lower extremities, particularly when a deep vein thrombosis or DVT is suspected. Some catheters allow for the use of a camera and instruments to facilitate stent insertion to help alleviate occlusion of the vessel and to prevent recurrence. A ventilation perfusion or VQ scan is a nuclear medicine study that uses a radioactive tracer dye to assess blood flow and airflow to the lungs. A VQ scan is used to diagnose pulmonary embolism or PE, which is a blood clot in the lung. Another type of nuclear medicine study is a multigated acquisition or MUGA scan. This test is also called a radionuclide angiography. A radionuclide tracer is injected and imaging obtained to evaluate the ejection fraction, which we abbreviate EF. This measures the amount of blood squeezed out of the left ventricle of the heart during one heartbeat. We also refer to it as the left ventricular ejection fraction, or LVEF. This value is reported as a percentage. Now we'll move on to non-radiation indirect imaging studies. Other types of imaging that are often obtained include magnetic resonance imaging or MRI, which uses huge magnets to visualize soft structures of the body like muscles, nerves, and tendons that X-rays cannot detect well. Ultrasound is also called a sonogram and uses sound waves that bounce off of body structures to create images. One specific type of ultrasound testing of the heart is an echocardiogram, often just referred to as an echo. Echoes can be obtained externally, and that's called a transthoracic or TTE echocardiogram, or internally called transesophageal or TEE. Abnormal echo findings include hypertrophy, which is an enlargement of the heart ventricles, dilation, which is abnormal stretching and thinning of the myocardium or heart muscle, and valvular dysfunction of one of the four heart valves that include the aortic, pulmonic, tricuspid, and mitral valves. Insufficiency or regurgitation of the valves is a common abnormal finding with leakage of blood when the valve is closed. There may also be stenosis or hardening of the valves noted that can cause leakage. Echocardiograms also measure the ejection fraction like a Muga scan does, and echoes also evaluate the great vessels, namely the aorta, pulmonary arteries, and the vena cava. Septal defects between the left and right sides of the heart may also be an abnormal echo finding. A duplex ultrasound evaluates the blood flow through a vessel as it's visualized. Two common types of duplex ultrasounds are a venous Doppler ultrasound and a carotid duplex ultrasound. Ultrasounds may also be obtained of the abdominal and pelvic regions to assess the gallbladder for cholelithiasis or gallstones, the liver for any abnormalities, and the female reproductive organs including the uterus, cervix, ovaries, and fallopian tubes. Pelvic ultrasounds for females may be external, called transabdominal, or internal, called transvaginal. Males may also undergo pelvic ultrasounds, but it may be ordered transrectally, particularly to evaluate the prostate gland during a fine needle biopsy of the prostate. Female patients may also undergo an ultrasound of the breast, most often during a fine needle biopsy of a suspicious mass. Other imaging diagnostic tests employ direct visualization using endoscopy that introduces a thin tube called a scope into a hollow body structure. The scope will have a camera to visualize the cavity and permit the use of instruments to remove pieces of tissue and other substances. For example, arthroscopy visualizes the inside of joints by introducing the scope through the skin over the joint. Instruments may be used to clean out or debride inside the joint. Laparoscopy involves direct visualization of the abdominal cavity by inserting the scope through the abdominal wall. Instruments may be introduced to perform surgery, like the removal of the gallbladder, called cholecystectomy. This procedure may also be called exploratory or diagnostic laparoscopy. A colonoscopy directly visualizes the rectum and large intestine, which is called the colon, by inserting a scope through the anus. There are 4 sections of the colon: the ascending, transverse, descending, and sigmoid colon. Instruments may be used to obtain biopsies and remove polyps. A cystoscopy is performed to visualize the urinary bladder through the urethra. Instruments may be used to obtain biopsies or perform surgery like transurethral resection of the prostate or a TURP. The scope may be advanced to the ureters, called a ureteroscopy, to remove renal calculi, also called kidney stones. Contrast dye may be administered through the scope with a kidney, bladder, and ureter or a KUB X-ray for a retrograde pyelogram. An esophagogastroduodenoscopy, or EGD, directly visualizes the esophagus, stomach, and duodenum. Instruments may be used during the procedure to obtain biopsies. Similarly, a bronchoscopy directly visualizes the trachea, larynx, bronchi, and lungs, and instruments may be used to obtain biopsies. Both an EGD and bronchoscopy enter through the patient's mouth. Now we will review some specialized diagnostic tests. One common group of specialized testing is electrophysical studies. The most often ordered of this category is the electrocardiogram, which we can refer to as an ECG or sometimes an EKG, which evaluates the heart's rate and rhythm. The results may indicate a normal sinus rhythm or a variety of arrhythmias. If the patient's EKG is normal, but they are symptomatic, the provider may order a 24-hour Holter monitor, which is a continuous EKG, to detect transient abnormalities that come and go at irregular intervals. Some patients with various peripheral nerve disorders like carpal or cubital tunnel syndrome will likely undergo electromyography or EMG, along with oftentimes a nerve conduction study, which we can abbreviate NCS. If the nervous system disorder is suspected to be within the brain, electroencephalogram or EEG may be obtained. Patients with suspected peripheral artery or vascular disease may undergo an ankle brachial index, which we can say an ABI. This test compares the blood pressure of the upper extremities to that in the lower extremities, as well as on the left to the right side. Those patients with known or suspected cardiovascular disease may routinely undergo a cardiac stress test. This test involves obtaining an EKG during exercise on a treadmill or similar device. However, it may be necessary to use pharmaceuticals to stimulate the heart if the patient is unable to tolerate activity. A prosantine thallium stress test, or an adenosine cardiolite stress test, also called Lexiscan, will be utilized in this case. A cardiac stress test may include an echocardiogram or nuclear medicine studies with the injection of a radioactive tracer dye. Imaging of the heart is then obtained. Two common nuclear medicine studies include a positron emission tomography or a PET scan and a single photon emission computerized tomography or a SPECT scan. A pulmonary function test or PFT will be conducted frequently for patients with respiratory disorders including COPD and asthma. This test may also be called spirometry. It evaluates lung function and volume or capacity. A PFT includes a gas diffusion study called a diffusing capacity for carbon monoxide or DILCO. Usually pre- and post bronchodilator medication administration values will be measured. Findings will include predicted, actual, and percentage of predicted values for the forced vital capacity or FVC, forced expiratory volume or FEV1, and the ratio of FE1 to FVC.